Folks, thanks for joining us today. My name's John Dubas with Premier Marketing, and we'll be spending the next hour or so discussing a vital component in a marketing program with any carrier at any time in the Medicare space, but particularly when we look and reach out to our partners who have tools and different products that can help us be more effective. We're looking to maximize our most valuable component, which is our time. So I'll shut up about an introduction and we'll get going with the presentation itself. You'll notice in the software package, there's a section for questions and a chat section. We find that we answer most of the questions through the course of the presentation, but of course, we love the reminders to make certain that we don't miss anything. And if there is something we don't answer, we want to address it. So if you would, put those questions in the question box, and we'll make certain that we get you the information you need to receive full value of your investment of your time here today. A little bit of housekeeping in a manner of speaking. Today's presentation is being recorded, and that recording will be sent to everyone who raised their hands with interest in today's presentation, but will also be in our training section on our website at premiersmi.com and on our YouTube channel as well. Sometimes the folks in marketing actually beat me to it and have that posted there before even the follow-up goes out. So watch for that as well. A little bit of level set as to our organization. Many of you are familiar with us, but kind of a level set for the rest of us. We're our national marketing organization founded in 1968. That's part of the Integrity Marketing Platform with offices across the country. We act as an insurance wholesaler working through independent insurance agents such as yourself, and we provide contracts at the highest possible commission levels with recruiting contracts available to those who qualify. We do so through a full portfolio of products that encompass the Medicare space, the Medicare Advantage, Medicare Supplement, and Part D programs, but we also have a full portfolio of life insurance and annuity products, final expense life insurance, pre-need plans, long and short-term care programs, disability income plans, and those ancillary benefits that are crucial for coverage for our prospects and book of business. And that includes the dental, vision, hearing programs, critical illness cancer plans, hospital indemnity programs, accident plans, and we even introduced a telehealth benefit a couple, 2-3 months ago called MD Live. When we look at the Medicare Advantage space, it has the national carriers in there for you, contracts available through our organization. And in addition to those national carriers, many of the strong regional carriers that can make a difference for you in your market. And that same philosophy carries over into the standalone prescription drug programs. Many of these plans, of course, are available with the same contract that you have for the MA programs as well. When we speak of Medicare supplements, we have a broad portfolio of products, including our featured guest today and different programs that are set in place to help you be successful in this space as well. You want to make certain that we have a portfolio of products that can address the needs across the board for our prospects and clients. And that includes the ancillary products, where in each of these categories you have the national leaders in that space. We find this is a valuable component not only to cover the needed benefit, which is of course most important, but it also creates an additional revenue stream and other marketing activities that we can utilize to broaden our space. When we speak of the Medicare market itself, of course, you come on a program like this, people speak of the aging of the baby boomers, the silver tsunami, one every 10 seconds, 10,000 plus a day. But if you're looking at Medicare based just on age, we're looking at a bit of a skewed number, because there are folks that become eligible for Medicare that defer accessing those benefits for one reason or another. And of course, we don't want to miss the folks that are qualifying for Medicare based on disability, those folks under the age of 65. So it's actually a larger market than it is if you look at just age overall. And it's a market that has a lot of needs that we can help address ahead of time and ensure the financial stability of our prospects and clients, no pun intended. Medicare population, 2/3 of them have 3+ chronic conditions. They have some income and assets challenges. So our being able to offer them products that address their challenges, no matter what their choices are, is very, very important for us and for our people. And also, of course, is a critical component of making certain that we have the products and the resources to do so. Because people, when they come on Medicare, they can even defer to Part B if they choose to do so. Most don't, thankfully. Some will do just traditional A and B and self-insure for the medical costs, perhaps pick up a standalone Part D program. A good percentage are going to go with the traditional, modernized, standardized Medicare supplement plans. And then there are folks also that will opt into and enroll in the Medicare Advantage, the Part C programs, kind of the, well, in the terms of the American Picker TV stories, a bundle. So whatever choice they make, they're doing it fairly evenly. Deaf research tells us that the folks that are just coming into Medicare, be they age-ins or late to Medicare seniors or whatever, nearly an even split between the Medicare Advantage and Med Sup programs. That's why some of the different things that we offer will apply to both the basic type of medical coverages. And then you have those original Medicare only, that nebulous category there. Well, that can be folks that are Medicare, Medicaid. It could be people that are accessing benefits through retiree programs from where they used to work. It could be folks with accessing care through the Veterans Administration. And it can be those folks that are self-insuring. So we want to make certain that these choices are covered by what we offer and that we're speaking their language. So part of the follow-up that you have will be a link to this acronym guide to make certain that we are properly defining what MICKEYMOUSE means. A little carried away there, but you don't understand where I'm coming from. We want to make certain that we help communicate with folks properly. And in our presentations, that means using as few acronyms as possible or spelling them out, so to speak. We want to help in the understanding so people can reach across the spectrum of products and do what is right for them. Many of the programs that we offer, well, gee, we have election periods, that the basic election periods for the MA and PDP programs. It affects the Medicare supplements as well, basically for one reason or another, if they want to come off or whatever, their MA or MA programs. We're already hearing talk for 2022. Many of the carriers are starting to reveal some of their benefits for that. But as we are still in the first part of July, we've got some bills to pay before we look at that. So we want to make certain that we are also looking at some of the standard special election periods and make certain that we are taking advantage of the opportunities to review people's coverages now and through the remainder of the year. Because outside of some of these, well, for want of a better term, standard special election periods, you also have the special election periods that are brought about because of weather or other factors. And this also will be part of the follow-up that you receive where you have a current listing of some of these SEPs, special election periods. And it's important for us to do some of these things now because, well, Kaiser Family Foundation tells us that the majority of people on Medicare are not reviewing and comparing their coverage options annually. And we know with our experience in this space, we, the collective we see that this can cost them a lot of money. So we need to reach out and make certain that we're also speaking with the most vulnerable population that are having some challenges with it too, or they're not seeing it or reviewing it. Some of it fear of losing coverage or whatever the case may be. But we want to make certain that even if they are reviewing their information, we are helping them understand it. It's the old reading comprehension. There we go. Fifth time, it'll work. We want to make certain that they understand what they're seeing. And sometimes that's why the acronym guide is helpful. That's especially why as an independent agent, it's really helpful because we can help them providing them with detail about their choices. Because face it, some of them aren't even using the plan finder that the government puts out on Medicare.gov. And even if they are, they're not doing anything about it. You'll note on this particular slide, this is one of the videos that the government has put out, over 6 years ago now. Very easy to follow, really kind of concise, 3.5 minutes. But you'll notice in those 6-year periods, not even 1 million people have viewed it. So you have resources out there that are not being utilized. So some of the things that we can bring with our proprietary comparison programs can be of great help to these people. And we want to make certain that we're able to do things and deliver this message in the manner our prospects and clients want to receive it in, and be able to pivot from an endpoint presentation to a virtual presentation or a combination thereof, because the folks have been trained over the last year and a half on receiving and digesting information in this manner. We're training them to do it. We across the board, the providers out there, the doctors are doing virtual visits. I have one physician I've had an appointment with 10 times and have seen him 10 times, 9 of them all virtual. Just the last one, that is a face-to-face. Boy, he was tiny too, by the way. But it goes beyond just the doctors and the primary care and specialists. We see this with a lot of the work being done by hospitals, dentists, even the faith-based community have been doing a lot of virtual presentations in a manner of speaking. So the folks are becoming much more accustomed to this, and this helps us, particularly when you work with a partner, a carrier partner, that helps bring this type of digital access and the tools that we need to provide and enroll people in the programs of their choice. So we've invited our dear friend with Aetna, Kevin Moore. He's the regional vice president for the Southern region, to come on and speak to us about some of the things that are being offered by one of the largest carriers out there, an organization that knows what they're doing and how they can utilize their portfolio and their technology to help you grow your agency. So at this point in time, I am going to turn control over to Mr. Moore, do what you've all been waiting for, and that's me shut up. And there you go, Mr. Moore. Kevin, you have the helm.
All righty. Well, thank you, John. I appreciate it, and I hope you'll let me know if you can't see my screen, but I think I have it set up correctly. And good afternoon, everyone. Thanks for taking the time out of your busy schedule to spend with us this afternoon. It's always great to do anything with John and all the fine folks at Premier. So I appreciate the opportunity to spend some time with everybody today. So what we're going to do is go into some things that kind of everyone should be aware of in regards to the Aetna Senior Supplemental portfolio of products and some of the other tools that we offer. Going to just spend a brief time covering some things that are related to product and the carrier, us as a carrier itself. And then we'll get into some of these special tools that are available to you, which is some of the newer, more exciting content as far as today's portion of the webinar. So as many of you probably are aware, the name of our division of Aetna is Aetna Senior Supplemental Insurance. We've been around for over 35 years in the business, so we're not new to the game, so to speak. We've been doing it for a while. Our home office is based in Nashville, so if you're ever looking for us or would like to come visit, just keep that in mind. Basically we do our best to give you a dedicated agent services team. We're very focused on business persistency. We know that's important to you. It's important to us as well. We are very, very focused on bringing you competitive premiums. We know that in the senior market, when you're trying to offer a high quality product, value is a concern, price. So we do our best to bring you premiums that are at a very competitive rate. And I think we do a pretty good job of that. Same goes for commission and renewals. We pay top dollar, and we have lifetime renewals on most or really all of our products. And then as John referenced earlier, our flagship product or our main product is of course our Medicare Supplement, but it doesn't stop there. We've got a lot of other products that are designed for cross-selling, and oftentimes you need to fill in a gap when it comes to coverage for one of your clients, and we've got a lot of great products that are designed for that. We are A-rated by AM Best, just in case you're ever asked. We are A-rated, and that makes us one of the best out there for you and for your clients, of course. Here's just a quick list of all the types of products that we offer. Of course, Medicare Supplement. We have a critical illness plan, which is called Cancer and Heart Attack or Stroke Plus. Hospital indemnity plans, a dental vision hearing product, a recovery care and a home care plus product that are designed as like short-term care type policies. And then of course we also have a final expense policy. Now we're not going to go into every product today. In fact, I really just tried to bring you a quick update on some of the products that have had some recent changes or updates so that you are kind of aware of the latest and greatest that's going on for MedSup. If you're marketing MedSup with us now, or if you're active in the Medicare supplement market, you probably know the biggest thing going with us is our Accendo product. So that's been about a year, but we're constantly adding and updating, bringing new states into the fold with the Accendo product. Just a quick breakdown on Accendo and kind of what it brings to the table in terms of a product and in terms of value. You may already be aware, but if not, I'll make sure that everyone understands today that we still have our existing Aetna branded MedSup product in just about every state that we've had that Aetna product. It still exists. We haven't pulled it or anything like that. We don't intend to. We intend to have, at this time, both the Aetna product and this Accendo product. So you have two products by Aetna or offered by Aetna, one under the Aetna brand name and one under this Accendo brand name, which Accendo is affiliated with the CVS name. And as you all are aware, probably CVS and Aetna are connected as a part of the same company now. So really the big draw on the Accendo product is that in most states, there are a few exceptions out there, in Florida being one of the biggest, is that we offer a 14% household discount. So that's huge. That's one of the biggest, largest discounts that is out there in the market. And also who qualifies for the discount is a key factor about what brings the excitement when it comes to the Accendo product. In most states, you can get that 14% household discount just by having someone living with you who's of an adult age. So it doesn't matter really what the relationship is. It could be a son or a daughter, grandson, granddaughter. It could be a spouse. Doesn't have to be. Any scenario in which you have at least one adult living in the same household with you, that they don't have to be on the plan, that other person, they just have to live in the same household, and that would qualify you for the discount. So that opens up the doors for a lot of people to benefit from that discount. So you can see it's currently available in, I think that's actually a little more than 33 states. We updated this, and I don't think we updated the number, but actually going to be launching in several new states later this month as well, if you look down in the coming soon section of this slide. So, we've got most of the country covered now, and then we are rolling out even more in the months and weeks ahead. So that's the latest and greatest that's happening with our Medicare supplement product. And as always, like I mentioned before, competitive rates. Our critical illness plan, I'm not going to spend a whole lot of time on this. In fact, there's really not any updates or anything new. I just like to take the opportunity anytime I can to remind everybody that we have this product out there. I'm a big fan of it, a big believer in this type of product. I think the likelihood of anyone being diagnosed with cancer, unfortunately, is very high. And also, unfortunately, we don't realize that beyond the health impact that it has on us, it has usually a pretty major financial impact. And I think that one sometimes can be tied to the other. Dealing with difficult financial situations can oftentimes lend itself to the difficulty in which you're facing on your health. So I think being able to help put some peace of mind out there if and when you're faced with a cancer diagnosis, or you have a heart attack or a stroke, or a family member, not necessarily you individually, I think being able to have some financial peace of mind is very, very important. So I just like to remind everyone we have this. It goes up to $75,000 in face amount, or as low as $5,000. You can write it on anyone between the ages of 18 and 89, and it's a lump sum payout upon diagnosis. You don't even have to go through treatment if you don't want to. If you just want to, have the money and use it for other things, that's fine. If you want to have treatment that's non-traditional, that wouldn't be covered by a major medical product, then you can use the money for things like that. So it's just a lump sum tax-free benefit paid upon diagnosis. So again, not a lot new about the product. It's pretty much the same as it has been the last couple of years, but I just like to take the chance anytime I can to remind everyone that we have this, and I really highly believe in it. I think everyone should take a look and consider it. I think everyone should have a policy like this. Now, the next product is something that's very new and exciting. In fact, we're rolling out in, I don't know, I want to say it's about 20 or so states tomorrow. I don't know the exact number off the top of my head, I'm sorry, but we're updating our dental, vision, and hearing product. So we've had it around for 2 or 3 years now, and it's been a very popular seller. But we've listened to the feedback from our policyholders and from our brokers and have tried to make some updates or enhancements that I think are really exciting. So we are calling the new version Dental, Vision, and Hearing Plus. And I've just got this is kind of a rough slide I threw together at the last second, but it's a comparison between our old or our current product versus the new one that's going to be rolling out as early as tomorrow, like I said, in about 20 states. So basically, everything on the right side of your screen that you see in red is going to be a new feature or a changed feature, which we believe is an improved feature. So you can go higher face amounts now, up to 2,500 and 3,000. In year one, for basic type things, Class A benefits, we used to only cover 60%. Now we're at 100%. Big difference there. Year two went from only covering 70% now to 100%. And then after year two, starting in year three, we used to only cover it 80%. Now with this new product, it will be 100%. And there's no waiting period for those Class A benefits. Your Class B benefits, that's going to be like intermediate level care. We went from covering 60% to 65% in year one, and then from 70 to 80% in year two. And then it's 80% every year beyond that. So an improvement there again. And then your Class C, this is going to be for your major type of work, like things that are, more serious in nature. We went from, 0 in year one to 20% in year one now with the new plan. And then from 60% to 50%, year three, 50% as well. So a little bit of a decrease there, but that was kind of offset to help offset some of the costs in the lower end tier type of care, which is what we were asked about the most. There is a 0 waiting period now for major work, which before there used to be a 1-year waiting period. So getting rid of that waiting period is huge. We used to not cover implants at all. We're now going to cover up to $1,500 lifetime on implants. Orthodontics used to not be covered at all. We do now have some benefits built in for that, quite a bit actually, which you can see there. I won't run all the way through it. So that's the dental portion. And then for the vision portion, we've improved a little bit there. There's also a little bit there as well. And then the same goes for hearing. You can see the enhancements there. And by the way, I'm going to make sure that John has a copy of this to distribute to everyone. So if you're not catching part of what's on the screen now, it's okay. And you can certainly ask questions, as John mentioned before. We will go back and address as many of those as we possibly can. So that's it as far as product goes. I just wanted to kind of bring you those updates, both on MedSup regarding the Accendo product, and then the DVH Plus, and then of course just the reminder on the cancer, heart attack, stroke plan. So I want to get in more to what tools are available to you as a contracted agent of ours. We've got a lot of things built in our website. One thing that many people don't realize that we have is a nice producer guide that can be downloaded from our website. To make it easy for you on this one, I've actually got a link here on this page. So when you get a copy of this presentation, you'll be able to click on this link to download that producer guide to your computer. And by the way, as long as we're talking about the website, I should make it a point to mention that our website can be found by navigating to AetnaSeniorProducts.com. Again, AetnaSeniorProducts.com is our website, AetnaSeniorProducts.com. Wanted to throw in a quick note about our agent services team. We've got a dedicated team there to support and help you. There is a new phone number. You may already have this. It's been out for a while, but in case you don't, you might want to take note of it. The new phone number for our agent services team is 866-272-6630. Again, 866-272-6630. And then our customer service number remains the same. It's 800-264-4000. So our agent services team is there to help and support you. They can help you with product and benefit details. They can help you with placing supply orders. Anything that's been communicated to the field that you have questions about. A lot of times we send out emails about new products and updates to the home office, things like that. Navigation and login support for our website, again, at SeniorProducts.com. Help and support on submitting a new application through our e-application, which we're actually going to get into here in just a few minutes. Same goes if you need help with a paper app. So these are out there for you. I mean, this agent services team, I should say, is out there for you if and when you need it. You can also email them, by the way, at aetssiinformation@aetna.com. This is something else that you can always access on our website, and I think this is important to have, especially if you're marketing in multiple states. This is going to be our product availability chart, which we update frequently anytime we launch or change a product or anything like that. So it's just a way for you to go in and check a particular state and see what all products are available there. And I know in this day and age, especially with more and more happening virtually, we market in multiple states. So checking this to make sure the product that you want to talk about is there to give your client information on is going to be key. So once you've navigated to the website as an agent, you want to go to the upper right. This is just a screenshot of the website here. You go to the upper right-hand corner to where the login section is, and you're going to select agents, of course, and then it will bring you to the screen that you see on the far right-hand side here. You've got a login portion if you have your username and password. If you don't and you need to register, you can click register now, and then it will give you the ability to set up access. You must be an appointed agent with us, by the way, to be able to register. Once you do log in, something we want to make sure everyone's aware of, a newer feature that we've just launched within the last 6-7 months, is going to be our chat function. So if you look in the upper right-hand corner of the website, there's a section for you to click on for chat, and you can actually begin a live chat with one of our agent services folks to help you through any issues or questions you may have. And it's been really handy and really popular, so I encourage you to take advantage of it. We also have a directory available on the website. If you click, again, in the upper right-hand corner next to login or log out in this case, then you can get a directory that will give you a phone number, fax number, email address for any department that you want to connect with. So here's what the home screen looks like whenever you're logged in as an agent. One of the biggest sections that you'll probably want to pay attention to is going to be down on the left-hand side, the Aetna Quote and Enroll. And this is just a highlight of that once you click on that. So when you hear us say or refer to Aetna Quote and Enroll, we're talking about our e-app. That's where you would go to access our e-app. And it's a very, very user-friendly and easy to help your client with tool. We've designed it with you in mind to make it beneficial for you to go through, submit an application for your client without having to see them in person and without there being any mistakes or errors on it. You will also notice if you want to practice on our Quote and Enroll tool without being in the live environment, we have a sandbox available. You could click on that link there, and it's exactly like the real thing, only you'd be creating not a real app if you were to go through the process there. So it's a good place to practice. And here's a whole slide on that sandbox there. Now, once you've gone into the live Quote and Enroll system, the first screen you're going to see is going to look pretty much exactly like what you're seeing here, where you're going to go in and start a quote. That's the first step to doing an enrollment, is kind of verifying that you have the products that you want to offer and at the correct price for your client for you to quote them. So you need to fill out a little bit of basic information. Once you do that, you click on View Products, and then it's going to bring you a screen like this, and it will show you actually a listing of all the products that are available. And at this point, it kind of almost becomes sort of like an Amazon shopping experience, because you can click on the plus sign to just add to cart any product that you want to look at alongside with your client, and you know, decide if they possibly want to purchase that product. So you can quote each product individually. You have the product brochure available for each product as a PDF for you to download and look at. You can share it with your client via email that way if needed be. You also have the outline of coverage available there for you to look at. And that's going to get into a lot of important details about the product. So it's always handy to have that available when you're talking about it. So if you were to click the compare or the quote, it's going to show you many different options. Here happens to be an example of a Med Sup, and it shows you the different plans that this person would potentially qualify for, and it shows you exactly what the price would be. And in this case, it has the Aetna product versus the Accendo product, because both products are available side by side, so you can see the difference. And then as you go through it, you make your selections on what it is that you want to sign the client up for. In this case, we've selected a Plan G. and we'd click add to cart, and then it would start the process at that point for that product. And then if you wanted to add other products on there, you can see the others are listed on the lower half of the screen here. If you wanted to add on a dental vision hearing or a cancer product or home care, recovery, any of the products that we offer that are available in that state will all be listed there for you to be able to talk about and do a quote for the client. And then, of course, eventually, hopefully add them and write up the application. So as you start filling in the application, it's going to come and want you to start filling in the pertinent information about the client, first name, last name, email address, things like that. They don't have to have an email address, by the way. That's a question that comes up sometimes, just optional. This is flipping back to our website a little bit now, not just the quote and enroll tool, but there's a quick reference guide. If you were to go into the training section of the website, which if you're looking at the left-hand side of the page now, you see these tabs that we have at the top of the page: home, products, incentives, my business, training. If you mouse over training, you can find a lot of really handy, helpful tools there, including this quick reference guide, which can actually help walk you through all the different things that you might encounter through the AQE system to help you along with any terminology or questions or products that you may not understand what's being referenced on the quote and enroll tool. It's all going to be right in there for you. You also have the step-by-step training video, which can walk you through an entire enrollment. Once you've done a couple of them, you aren't going to need this. I wouldn't try to go back to this after you've already done one enrollment, because it's probably going to just make it slower for you than need be. But if you're not sure how it works and you want to get comfortable with it, I would start here and go through that process of watching that step-by-step video. We also have, under the training tab on our website, other things that are available, including our webinars, kind of like this one, but a little more generic, or a little bit more specific, I should say, towards a certain product or a certain subject. So that is an option there to look at our schedule, our calendar of webinars, and you can see there it pops up showing you, okay, this is back in May, but May 27th, we had a webinar for online contracting on how to get through that process. On June 17th, we had one about the agent website, and so on and so on. You can just pick whichever one you're interested in and sign up to attend that session. This is another section of our website that is going to offer some really user-friendly agent tools that I think you can use. It's pretty underutilized, unfortunately. A lot of people don't realize this, but if you go to the products tab on the upper portion of our website, you're going to notice on the drop down that there's a section there for agent flyers and ads. And what you will have is the ability to use download a particular flyer on a specific product, and you can customize that with your information and your client's information to mail out a brochure or mail out a flyer to advertise the product. You could do this in mass. If you had a list of potential, or a list of seniors or a list of clients in a particular area, whatever the case may be, you could actually get labels printed to put on these cards and to send them out. Here's an example of one for our dental vision hearing. You notice everything's customizable. You can take this file and do it however you want in terms of addressing it to and from. And it's a great way to get some leads if you utilize it correctly. So I would encourage you to take a look at that. And by the way, just again, to get to that, you would go to the products tab and then go to agent flyers and ads to access that. And this is just one of many that are there. You can also order supplies. If you go to the order supplies and download forms, not only can you order supplies, but you can also download a PDF of any product document that we have, a brochure, an app, outline of coverage, whatever you can think of associated with any individual product, you can get that through there. So that's just some examples of, this is getting in a little bit further into how you would actually order supplies or download supplies. It's pretty self-explanatory once you get in there. We also have some on-demand videos on our website, and these are really handy. And again, a lot of people aren't aware that these are out there, but the links to the videos are going to be in this presentation if you'd like to spend a few minutes and watch any of these. These are all done like professionally with a paid actress, and you have two versions for most products. You have a version for a client if you wanted to show it to a client, And there's also a version that's more geared towards an agent. So take advantage. The videos are very, very informative and help you get a better feeling for how our product works. So something else that's not on our website, it's something you can download to your phone or your tablet though, is our mobile Quotes on the Go app. It's just an app for you to put on your phone or for your electronic device to help you quote our products. And the way you would get it is either go to the Apple Play Store or the Google, or the Apple App Store, and the Google Play Store if you're on Android. And all you need to do is type in the words Quotes on the Go, Quotes on the Go, and that's going to bring up our app. You'll see it on the web store there, on the App Store, the Google Play Store. Just download that, and I use mine all the time. It's very handy. I can't tell you how many times I've been, standing in line at the grocery store, and the next thing I know, I'm helping someone quote a cancer, heart attack, stroke product for themselves. So, it's a handy tool. I would use it. You can't do a full application, but I don't know that you would want to on your phone, but you can do a quick quote, and it's very handy for that. So here's our team, by the way. Depending on what state you're located in, you'll kind of have a different team, a regional team that works your area. For example, I cover what's called considered the southern region, which is most, Texas and a lot of the other southern states. I think the next screen actually has it on there. Yeah. So West, Midwest, East, or South, if you look at the top of this section, you'll see the different states that fall into each one for us. So whichever state you're located in, where you do most of your marketing, if you want to reach out to your regional team for help or questions or just to have a conversation, we'd love to hear from you. Give us a call. I'm happy to chat with anybody and do what I can to help support you, or my regional sales manager or my regional sales specialist, any of us the same. And of course, each team has that 3-person crew, except for one. We're short in the Midwest there. We had someone who recently went to another department, but other than that, we're all here and ready to help you. So that's really all I had. I'll stop, John, if you want to take any questions and answers, or if you want to go from here and then we can come back to this. It's up to you.
At this point in time, Kevin, we've got a very thorough presentation that's covered the questions of the audience today. I think I'll throw out this little piece here too, of with the product portfolio and your quoted enroll, that really helps with the cross-selling aspect of a lot of what we do. Any recommendations on how to make that as simple as possible, or refer people back to the quote and enroll full presentation, or what do you think?
Yeah, I mean, it's a great question. I think that comes down to, as an agent, what's your mindset going into helping your client? I, for one, am pretty passionate about the idea of having a major Medicare product, whether it be a MedSup or a Med Advantage, being the foundation of a great lineup of coverage for your client. But then there's other things that can be added on. Let's talk about what we can bundle together, which is what our quote and enroll tool is really designed to do. It's designed to be able to help service you, helping your client beyond just their Medicare supplement or beyond just their Medicare Advantage. What can you bundle together? And it's designed to give you that overall feel of, okay, if I put this product here and then added this product in, what's it going to cost? And it's at your fingertips information available to quickly relay that to your client and quickly, settle on what's the best way to cover themselves top to bottom. A Medicare supplement, and for the most part, most Medicare Advantage don't do a lot in terms of dental. Dental is one of the biggest things that's asked about by seniors. So we've got the product built in for you to slide that in along with your MedSup sale, or, after your Medicare Advantage sale. So just going in with that mentality, that's my best advice on how to handle that. The tool, the Aetna Quote and Enroll, will help you do those things, because it gives you that ability to add multiple products all at once and do the quote individually or together as a whole for your client.
That's awesome. And those improvements in the dental program are just outstanding. That's awesome. I think too, it's important to note at this point in time that if we're talking about just the Medicare supplement and the ancillary products, it is a different sort of compliance requirements up front, where of course you don't need a scope of appointment for those products. In most cases, you'll get one because you want to prep for the other discussions, and then you're talking MedSups, PDP programs come up very quickly. But I think that's one aspect of this portion of Aetna's portfolio in the senior supplemental division, where some of the requirements are different. You can cold call for MedSups and the ancillary products. You can't with the MA or PDP programs. So I think we've covered questions. I'm going to pull back control and close out with just a few pieces as to why people would want to work with us in this arena here at Premier Marketing. And I think one of them is, of course, keeping your business together to a degree, having some organization. Creating a profile through SuranceBay gives you a place to store your E&O information, answer a lot of the questions, pick up some of the contracts very simply and electronically. We, of course, want to make certain that when we deal with Aetna, we are handling systems that are apropos to the carrier. And so we will do some direct contracting there, but a great way to keep your things in a specific place, technical term. We also offer discounted errors and admissions coverage for qualified agents. And this is a program you purchase and you own. So it's not like being added to a blanket E&O policy for one program and then worrying about coverages across the board. This is something that's given to you, well, you purchase it at a fair price and it covers you regardless of whom you're contracting through. So it's a great way to satisfy that E&O requirement that most insurance programs have now. Well, just about every one that I'm aware of. But we also help you with your licensing as well, with discounted continuing education credits through our association with WebCE, and a way for you to enhance your own benefit structure through a modified guarantee issued DI policy, disability income, since I beat up the acronyms earlier in today's presentation, but it's one that you basically write on yourself and get paid a commission on. Much as where today's presentation is being recorded, the past presentations have been as well. You can find them on our website, on the address here, on our revamped website, and also on our YouTube channel. So it gives you access not just to product information, carrier information, but different marketing programs that can help put you in front of people that are qualified and interested in the programs that you're offering. I cannot go through a presentation like today's without mentioning and expanding upon our Medicare Center program that's available without cost to contracted agents, where you have an all-in-one universal login on any device, anytime, but it gives you access to a CRM that you can use to manage and track your clients. It's a way for you to send out the scope of appointment by multiple means and storing it for that 10-year requirement that we have, whether you sell the programs or not. But it gives you access to 3 quoting apparatuses, including our programs that are powered by Connecture, Sunfire, and by CSG as well. And pardon me, I just knocked a cord off here. There we go. Important one, a charger. And that actually gives you access to a cross-selling tool here as well. So many circumstances you go in, well, certain circumstances, you're going into a house or you're in a discussion, someone's looking basically for reassurance. Oh, hey, I still have the best program out there for me. This gives you an access to a tool that if it's an MA program, you can kind of fill in the holes using this tool for a hospital indemnity program, other ancillary benefits that give you the opportunity to still get a sale and enhance the benefit structure of the folks that you're visiting with. And that's important because the more product you have in the household, the higher your persistency, the higher the retention of your book of business. Less expensive to do it that way, but it also drives those folks up so your book stays there. And keep in mind, as Kevin mentions on these, in many cases, it doesn't matter who the product is with. It does, but all that product has to go through the same agent, and that's you. And so that's important. We also want to make certain that you're getting full compensation for the sales that you're offering. And many of the carriers offer different incentives and trips that help you qualify for premier incentive programs as well. Aetna does a wonderful job at offering these incentives, and that's something we want to make certain that you're aware of. So you have a singular point on our website to access that information. Last year, our incentive program changed from a cruise to cash in pockets. Gee, I wonder why that happened. Well, that's the new reality at that point in time. So it's cash. We also want to help get you in front of people. As I mentioned before, you can cold call for med subs and ancillary products. So we have custom contact lists available for you at low or no prices, depending upon your contractual relationship with us. And we also help you with the different community-based programs, the retail programs that are out there concerning, well, Walmart program on its third round of site selection now, but many of the carriers offer their programs specific to their company, and Aetna does that. So that's some of the things we want to make certain that you're aware of. That gives you another opportunity to offer the portfolio that Kevin mentioned today, in addition to the MA and PDP programs. We also have ways for you to work with faith-based organizations, providers, different centers of influence in the community. As I mentioned a little bit ago, those are recorded and on our website and on the YouTube channel. Many of the carriers do also offer prospects to folks. This is a symbiotic relationship that if you've done business, and it's particularly in the MA and PDP space, where you are getting support from the carrier in that aspect as well. To find out availability of these programs for you in your network, in your market, we want to make certain that you know the carrier reps and how that is handled. We do offer internet leads and direct mail support, and we have an interesting program to help you grow your referrals as well. So when we speak of the direct mail programs, there's actually two of them. They're through preferred lead vendors, and they're based on production, but you can qualify based on the health programs and also on final expense programs. And as I mentioned, it is through preferred lead vendors. That way we can make certain that we're vetting the information that's going out and protecting you on a compliance basis. We do also have two different programs that help you access just the responses. These are never touched leads before. The prices will vary, but in this particular circumstance, the gig direct mail programs also have an MA lead source in them as well now too. So a way for you to fill in some lead activity, but also make certain that you have the opportunity to do things on an ongoing basis and still fit your budget. The internet programs that I mentioned are Facebook based, and there are programs for final expense and Medicare as well. We can get you additional information on that. But I think one of the most important leads is engaging your book and asking for referrals, even with people that you don't sell, because they may be in a different circumstance, but know of folks that you can help. And we want to make certain that we're maximizing the value of every outreach that we're doing, telephonically, face-to-face, however it works, and grow that part of our business. We do all this simply because we want your business. We want your referrals. If you know of agents that we can help, send them our way. If you have questions about different portions of the portfolio that are available through our organization, obviously we want to help you in that area as well. But we feel that Aetna's portfolio in the senior supplemental division gives you a broad portfolio of products, very, very competitive in the benefit structure. You have great support, not only with the feet on the street, so to speak, but also with the different products and the electronic and marketing support that you receive. Kevin did a great job of highlighting some of that material and making certain that you're aware of how you can integrate that into a planning program, a personal marketing program, not just for AEP. We're already getting caught up in that discussion of, well, the old Annie Broadway song, there's always tomorrow. Well, that tomorrow is tomorrow. In reality, too, we need to do business through the remainder of the year. It's a great way to integrate that in and get it moving. And that's a decision on your part. But as my hero John Wayne says in the Cowboys, slap a piece of bacon on that biscuit, saddle up and let's ride, because we're burning daylight. The time to integrate these programs is now. It's always now. And we give the mindset of, here's the material, what's it take, what's our next steps, and you do so through a visit with one of our marketers or agent success managers. And you can give them a call, 1-800-365-8208. If you're working with a marketer now, obviously they're going to help you with this program. If you're not yet associated, with Premier Marketing, we'll make certain that we set you up with a subject matter expert in your neck of the woods. You can watch for the follow-up that we send as well and respond to that, or visit us on our website at premiersmi.com and make certain that we are getting you the detail that you need as well. A couple of pieces checking the questions, a copy of the presentation. Yep, Carol, you're going to get that. And not only the presentation, but also the link to the recording today as well. So everybody will receive that who raised their hand with interest in today's presentation. All that said and done, we realize your most valuable component is your time. I thank you for doing that with us here today, where you are visiting with us and spending an investment of your most valuable resource. I want to thank those that have worked with us in the past. We appreciate the business. For those of you that are about to, we thank you for that opportunity as well. So all that said and done, until we have another chance to speak, hang on half a second, I'm going to check the questions. Once again, yes, we have it there. I want to thank Kevin for coming on and helping us with the presentation today. Thank you very much, Mr. Moore. And for all who attended, until we're able to visit with you again, we wish you good selling. Thanks so much, and we'll talk to you soon.